We are going to continue with Part 7 of our Fastidious Gram-negative bacilli lecture. And in this lecture, we're going to focus on the organism Bordatella. Bordatella has several species, 3 of which are clinically relevant. One of the species is pertussis, another parapertussis, and the third bronchoseptica. Some of the other species include Bordatella avium, Holmesii, Traumatum, and Hinsii. We're going to focus, as we usually do, on the clinical relevant organisms, and we start out always with our major pathogen of that group. So the major pathogen of the Bordatella organisms is Bordatella pertussis. Now, Bordatella pertussis has several virulence factors, one of which is filamentous hemagglutinin. And filamentous hemagglutinin mediates agglutination of erythrocytes. It is also involved with attaching organisms to the respiratory cilia. So the filamentous hemagglutinin and pertussis toxin being one of the major virulence factors that Bordatella pertussis produces, work together, and the FHA allows the organism to attach to the respiratory cilia, and the pertussis toxin starts to destroy the cells in the respiratory tract. And antibodies against FHA, or filamentous hemagglutinin, are protective. Now, the pertussis toxin resembles the diphtheria, cholera, and the Escherichia coli heat-label toxins. It affects the adenyl cyclase, phospholipase C, and ion channels. And the effects of the toxin depend on the cell type. So the toxin can generate histamine sensitization, promote lymphocytosis, insulin secretion, and can inactivate immune effector cells. The toxin can also bind that bacteria to the ciliated epithelial cells along with the FHA that we just talked about, and antibodies against pertussis toxin do confer immunity to the individual. There's also tracheal toxin, and this toxin destroys the ciliated epithelial cells of the trachea. When tracheal toxin is working, it generates an accumulation of mucus, bacteria, and also inflammatory immune cells in the lungs. And that is what is causing that cough, is the destruction of the cells and all this accumulation of mucus in the lungs, generating this cough that is known for Bordatella pertussis infection. The adenylate cyclase toxin interferes with leukocyte or white blood cell chemotaxis, so getting the white blood cells to that area of infection. It interferes with polymorphoneutrophil superoxide productions. So your neutrophils in your body can generate toxic oxidative radicals, and these oxidative radicals play an important role on killing bacteria that the neutrophils phagocytize. And of course, this toxin is also anti-phagocytic, so not as many phagocytic cells are going to be able to come in and gobble up the organism that's producing this toxin. The pathogenesis of Bordatella pertussis, someone that gets infected with this organism, we already said that the organism attaches specifically to the ciliated epithelial cells in the bronchial region of the body. The toxins destroy those epithelial cells. However, non-ciliated cells in that region of the body are not affected. So only the ciliated cells are affected by the toxin production. And you also get local inflammation, and you can get an exudate that's formed. The diseases, well, Bordetella pertussis causes whooping cough. 1 to 3 weeks, and it's usually between 7 to 10 days, is the incubation period, and there are 3 phases of the disease whooping cough. There's a catarrhal, a paroxysmal, and a convalescent phase. In the catarrhal phase, that has a 1 to 2 week duration, and it has very non-specific symptoms. They're very similar to a general cold, not feeling that well. It's in this stage of infection that the organism is highly transmissible. See, this person does not know they have whooping cough. They're getting some symptoms, thinking they're getting a cold, coughing all over the place, and this is causing the organism to be spread. The paroxysmal phase is the next phase, and it lasts 2 to 4 weeks. And here is where you have the very characteristic coughing, which it sounds like a whooping. And the reason for that whooping is because it causes such a persistent cough that people have a very difficult time breathing because you're just coughing, 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 coughing. So in between some of those coughs, the individual's gasping for air, which generates this whooping noise. And there's a clip on Blackboard if you want to hear the very characteristic cough that is caused by Bordetella pertussis infection or whooping cough. In the convalescent stage, this can take weeks or even several months, but the individual usually has a complete recovery. Now, of course, an infection, especially one that lasts this long, can lead to complications. So you can get pneumonia, and this is usually a secondary bacterial infection. So you have Bordetella pertussis, you're getting all this damage, you're getting, this cough, exudate buildup in the lungs, and other bacteria will come in and infect the lung and cause pneumonia. And pneumonia accounts for the majority of the death due to Bordetella pertussis infection. It's been known to cause convulsions, hemorrhaging, hernias. I mean, you're coughing so much, usually the capillaries in the eye you'll get little petechia and capillary breakage in the eyes, and you could get a hernia, an inguinal hernia, where part of your intestine starts to come through the lining. Now, cases in the United States, there are cases every year throughout the United States, but if you look at the graph in the right-hand lower corner, you can see that there was a little spike of Bordetella pertussis infection in around 2004, 2005, and then another one in 2011. And these spikes of infection, and keep in mind this is the number per 100,000. So when you think of the entire population of the US, this is a pretty significant number of cases. So these spikes are due to a decrease in vaccination. Now, Bordetella parapertussis is another species, and this is an opportunistic organism. It generates a similar disease to Bordetella pertussis, however, it's much more mild. The general characteristics of Bordetella are that it's a strictly human pathogen. So it's not sitting around, very long on surfaces. It's not an animal pathogen. So strictly human pathogen carried in the upper respiratory tract can lead to mild infections, and you can have asymptomatic carriage among adults that are immune. Transmission is usually airborne droplets through the coughing, and usually that's with people that are in close contact with an infected individual. The best way to prevent Bordetella pertussis infection and whooping cough is active immunization. So there is a vaccine, the DTP or DTaP is given to children 6 years and younger, and there are 3 doses of this vaccine given. In adolescents and adults, the Bordatella pertussis vaccine is combined with diphtheria and tetanus. And usually, used to be called DTP, diphtheria, tetanus, and pertussis. It's now called the Tdap, and it's given to adolescents at 11 or 12 years of age that either missed one or more doses of the original DTaP vaccine. It's also given to adults and pregnant women who have not been vaccinated. Now, treatment in an individual that is infected, very early on you can give antimicrobials such as erythromycin to decrease the transmission to other individuals. However, once a person has the disease, you're not really treating to get rid of the disease as much as trying to limit the disease being transmitted to other people. After the paroxysmal phase, usually the treatment is only supportive, so trying to get the individual to build back their lung capacity and stop coughing and repair those ciliated cells, and if they have a pneumonia or any of the other complications, to treat those. Bordatella pertussis is classically diagnosed by symptoms. A child who hasn't been vaccinated, has the characteristic whooping cough, is pretty easily diagnosed. In the laboratory, you can get a nasopharyngeal swab. However, it's important to note that it has to be a Dacron or Dacron swab and not a cotton swab. Now, direct plating is the absolute best way to diagnose Bordatella pertussis. So this is called a cough plate. So what you would do is, let's say someone is hospitalized, you would bring a plate right up to them and hold it in front of their mouth, and they would cough directly onto the plate. You would take that plate and immediately incubate it. Of course, you would want them to cough on media that's going to support the growth for Bordatella pertussis. And again, this is a fastidious organism, so it's going to have specific growth requirements. The organism is highly sensitive to drying out or desiccation, which is why a direct plate or the cough plate is the best method to collect the specimen. If the specimen is collected using a swab, you would want to use the appropriate transport medium, such as Regan Low transport medium, to transport the swab from the doctor's office to the laboratory. You can do direct immunofluorescent testing on a swab specimen to look for the organism. Now, the organism growing on an agar plate is very small. These are gram-negative coccobacilli, so teeny tiny rods. Colonies won't show up on a plate until about 3 to 5 days, so they're a little more slow growing than your typical bacteria. They generate small, glistening, compact colonies that are usually described as pearls or drops of mercury, and this organism is a strict aerobe. So here's a gram stain of Bordatella pertussis, and as I've said before, your gram-negative rods, it's very difficult to tell one from the other just by looking at a gram stain. I mean, you can tell that it's a coccobacillus, a teeny tiny rod, so that might allow you to narrow down and think about your coccobacillus organisms as opposed to your big, huge rods like a bacillus species. But in general, you don't really want to look at a gram stain to get a diagnosis. It just allows you to say, okay, it's gram-negative, it's coccobacillus, and think about all of your organisms that are gram-negative coccobacilli. So that if some of you are making charts, that would be a chart that you would make. Start listing all of your gram-negative coccobacilli. Now, it is a fastidious organism, so it has specific growth requirements, and these specialized media for Bordatella pertussis, one of them is Bordatella, and another is Regan Low. Now, for these types of media, we said the organism is very sensitive to desiccation. So these media contain fresh blood to absorb any toxic substances. They contain things like albumin, charcoal, starch, as well as antibiotics to inhibit the normal oral flora that would be present in a nasopharyngeal swab or a cough plate. And here's Bordatella pertussis on Regan Low media, and you can see it does look like tiny little pearl drops. Now, Bordatella pertussis is a fastidious organism that requires charcoal, starch, blood, and albumin for growth. It is non-motile and it does not ferment carbohydrates. Bordatella parapertussis and Bordatella bronchoseptica are much less fussy. These organisms can grow on 5% sheep blood agar plates as well as MacConkey agar, whereas the Bordatella pertussis cannot. And Bordatella parapertussis and bronchoseptica are biochemically active. So you can do numerous types of biochemical tests, such as fermentation tests, to differentiate these two organisms. So we're going to move on now to the last part of our lecture.